This session is titled Understanding ADHD, and briefly, ADHD was a relatively unknown condition 20 years ago. Today, rates of diagnosis among children and adults are increasing, while clear information and resources are harder to find and locate. In this session, Dr. Isha Sharma from NIMHANS and Dr. Divya Nallur from the Amaha Mental Health Center will be in conversation with Menaka Raman, who is the moderator. She's also an author and podcast producer, and they'll discuss ways in which ADHD can be better understood and engaged with. If I might call the speakers and moderator onto stage, please.
So nice to see so many of you turn up for the first event and discussion here at Mannotsava. Very good morning to both to Dr. Sharma and to Dr. Nallur, who are going to be on our discussion today on better understanding ADHD. So very quickly, if you're all wondering why I've been asked to moderate this discussion with both these doctors, it's because my 16-year-old son has ADHD, and he was diagnosed when he was about 11. So for the past 5 years, my own family has been trying to better understand him and see how best we can support him, through his own journey into young adulthood. So like Gautam said, in the last few years, we've really seen kind of a lot more interest around neurodiversity and around trying to understand ADHD and ADD, ASD. All of these kind of things have really kind of bubbled up into mainstream conversations more and more. And of course, the pandemic has been seen as a kind of catalyst for some of this. And we're seeing a lot more discussions online, popular culture, it being reflected in cinema, TV shows, and books, and things like that. And while, of course, there has been more diagnosis, and of course, we'll talk about self-labeling and things like that, lots and lots of different things happening. I think many people are still trying to understand exactly what is ADHD and, what does this mean if you find out your child has ADHD or you yourself, have this diagnosis. So I think maybe we should start off with a question to Dr. Sharma. Can you tell us what is ADHD and what is it not?
Yes. Thank you for that question, Shraman. So, see, if I were to just, kind of draw it out for everyone, see, when a child is born and as they grow up, there are different kinds of abilities that they develop, right? So a child learns how to walk, how to climb upstairs, how to talk, how to interact socially. So there are all these wonderful abilities that are actually emerging over childhood and then maturing more and more as they grow up. Now, one of these abilities, so one of these developmental abilities is the ability to pay attention, is the ability to sit down, focus, do your work for as long as is needed to complete that particular task, right? So attention and concentration are brain abilities. Similarly, as you would all, have seen our little tots, when they learn how to start walking, when they learn to walk, they can't stop. It's so hard to make a 2-year-old or a 3-year-old sit down. They want to do everything walking. So you see that, walking and climbing and running keeps increasing till about they are 3, and then it starts to settle down. And that's usually the age when they start preschool and formal schooling and so on. So the ability to regulate their physical behavior, their movement as they grow up, right? So that's also a developmental ability. Similarly, young kids don't really know much about what is allowed, what's not allowed, so they're going to touch everything. Whatever comes in hand can be thrown, can be opened up, can be torn apart. So they're basically exercising any and all impulses, any and all ideas that come into their mind, right? Which is impulsivity, in other words. So these are all actually developmental abilities, the ability to concentrate, the ability to regulate physical motion, movement, and the ability to regulate our impulses. Now, when there is a developmental difficulty or a delay in acquiring these abilities, you have this condition called attention deficit hyperactivity disorder, right? So it's essentially the brain development not happening at an expected age and time for a given person, right? So that's what ADHD is. What ADHD is not is when you're in college and after having reasonably well, achieved exams and things throughout your school life and so on, now I find myself can't finish this, can't complete a project, or I get bored easily, or, I feel very anxious. I think, I need better focus. So suddenly discovering these problems, as we face bigger and bigger challenges in life, most of the time, there are other ancillary reasons around it. But typically ADHD is something that will, emerge over childhood. And, like I said, it is to do with developmental abilities and how children acquire them over time.
I don't think anyone's quite explained what my own son has to me so clearly and so well. So thank you for that. So it's interesting that you mentioned that it's not really something that you might find that you have, as an adult. But having said that, more and more adults are finding out that they have ADHD through a number of different ways, which I'd like to come to in a bit. So then, Dr. Nallur, to you, why is it then that we are seeing so many adults, as from, say, in their early 20s, and even, people who are in their 40s and 50s, saying that, I think I have ADHD, and finding out actually that they do. So why is it that those adults have not learned that they have ADHD at a younger age, and what are some of the reasons for that?
So, like our introduction was given by Gautam, and he said about 20 years ago, we did not have ADHD, or if we did have ADHD, we had ADHD as a diagnosis of childhood, right? And also it was seen as a very Western phenomenon where people were labeling just overactive kids as children with ADHD, and this does not happen in India. It was a little bit of the thinking around it. And then we obviously have progressed from there, and then there's been a lot of genetic studies, and we know this is really a disorder. In some people, attention, hyperactivity, impulsivity is to a degree that it can be called a disorder. And so it got proved that ADHD in childhood is a reality. It's not really just an overactive kid. Then where do these children go suddenly after 18? If you're saying this is a neurological disorder, then at 18 it magically vanishes. That cannot be possible, right? And so it's only after that that ADHD in adulthood started being picked up. Why right now we are picking up more ADHD in adults is probably a number of psychosocial reasons. It's probably because of a lot of awareness, especially with social media portraying it a lot. And why were they not picked up earlier is a lot of things, right? In the Indian context, especially in women, we see we are trained to be subtle and quiet and don't raise your voice, don't run around. There's a social cue to it. And so the restlessness, the agitation, the hyperactivities goes inwards rather than being very demonstrative outwards. So maybe we didn't pick up a group of people because the symptoms didn't come up as much in childhood, or that their IQ was high enough that they somehow managed to do okay in academics. And a lot of Indian schooling is around, is the child getting enough scores? Is he passing the exam? And when that is achieved, even if the child is not sitting okay in class, or it's okay. Or maybe the child was in the middle of a 5-bench seat. They were right in the middle. There was no way they could get out of seat, right? So maybe they sat in the chair because there was no other option. And so a lot of psychosocial reasons why maybe these adults didn't get picked up. And maybe also that families in India are a little more permissive of children being restless. And also parents are more hands-on here than maybe in Western countries. I've had a few adult patients with ADHD who, when I interview the parents, they'll be like, but he didn't need to do that. Like if I say, did he have a messy room as a child? Would he organize his bag? Be like, but he didn't have to do any of it. So how do I know if he had the ability to do that or not? So it's a lot of psychosocial factors, I think. And also sometimes it's subtle enough not to notice. And if they have the personality or the IQ, they may hide those symptoms effectively that teachers and parents may not have seen it.
That's really interesting when you bring up the fact that if your child is doing well academically in school, then that means that everything is okay and it's all fine and that there's really nothing to worry about. I think that's, a lot of teachers and parents, sometimes feel that way. But having said that, the COVID-19 pandemic and the shift to online schooling is actually sometimes considered one of the reasons why so many parents and educators, kind of thought, okay, maybe there's something over here we need to look into a little bit more. So Dr. Sharma, can you speak a little bit about what was it about the pandemic and online schooling that made this happen?
Yeah, so I think, like the way I was talking about, it's at the end of the day, all our abilities, they sort of get, used to over a period of time to, working in certain environments, so you train a child to go to school, with or without ADHD, so this template is drawn and, every morning this kid knows I have to get up, pick up my bag, board the school bus, go to school and come back. And so what happens is that, some of us are very good at doing it, some of us are kind of okay doing it, some of us are not great doing it, but then over a period of time, practice, repetition, habituation, so much of that happens. And all of us, you were talking about neurodiversity, so as neurodiverse as we may be, we get adjusted to a particular mode of operation. Now, come the pandemic, and what happened overnight? A lot of schools all over the country decided we must complete the course, we must complete the curriculum, years must not get wasted, and so on. I'm sure there were very good reasons behind it. But the shift to the online schooling happened just like that. Kids were expected to kind of start participating in it as if nothing had happened. You're sitting in a class and now you just come online and, there'll be a teacher who'll be doing a PowerPoint or may actually be just talking directly into the camera. They'll be giving sums online and, some worksheets online. So unlike what the school was thinking for the children, this was a big shift. And in child mental health, we very often talk about children's ability to adapt to change, right? Because as adults, you are most of the time thinking and solving everything in your mind. But for children, change is physical, emotional, social, and to do with thinking. For adults, a lot of change is, how you think about the change. And, you convince yourself that there is a very good reason I need to shift, to this. But for children, they're not operating in terms of curricular outcomes and, financial outcomes and so on. For them, a change is a real thing, so it involves a lot of adaptation. Online schooling was, at least to begin with, hard for every child. And now put into context children who were anyway struggling with focus. They were anyway struggling with sitting in a place. They were anyway struggling with managing their impulses. And now you tell them, so in the classroom, there's still some leeway, isn't it? You can pick up a pencil, you can throw it under the table, you can do something with the restlessness and the fidgetiness. But the online space, you can't really do much. You just have to be there. And so then, it either got picked up as a child saying, I can't do this, or it got picked up as parents saying, he or she is doing everything but attending the class. So there are multiple tabs open, and so on. But it's basically this kid, who's doesn't have a great attention span, trying to figure out what am I supposed to do here, right? So I think the drastic shift, which literally happened overnight, was one of the reasons which, suddenly uncovered so many kids who have learning problems.
And so this is a very particular case of, children being put in this very kind of new situation and being asked to do these things, and then finding out that they couldn't, or their parents kind of realizing they couldn't. For adults, what was it about that? Because I think, like we've discussed, by adulthood, you've kind of taught yourself to do certain things that you might not want to do, that are boring, that are not interesting, and you just kind of get on with it. So then what was it about the pandemic and lockdown that helped a lot of adults who had not had a diagnosis in childhood come to this realization that, hey, maybe there's something going on here that I've all these years, people have said it's because I'm lazy, or it's because I'm this or that. And there are a lot of labels other people put on us and that we put on ourselves. So what was it about the pandemic that made adults then realize that I need to look into this a little more?
A little bit similar to children, obviously. So we suddenly went from a very chaotic world to a very quiet world. And everyone was like, oh my God, what do I do with this quietness? And then you had to just sit at home, not do much. And like Isha said, when you're in an environment, in a workspace, you still have the, like liberty to go speak to someone, to go to the coffee machine. So there was like energy spent, which suddenly was like, there's nowhere to spend that energy, and there's no socializing. And also they got a lot of time to slow down. And when you slow down, you start observing your behavior or your family's behavior a lot more. I think that happened. And then work went online, right? It is so much easier to, for everyone to focus on our conversation right now, because kind of we are human social organisms and we connect when we see like this. So it's not just my voice, but a lot more that is keeping your attention to what we are speaking. But online, this connect is lots. So when adults had to focus on long meetings, 30-minute meetings, 1-hour meetings on a screen, it became harder. And also the decrease in, so a lot of people, so one of the young adults I see was a national level swimming champion. And COVID came and she had to stop swimming. And so where does that energy go? A lot of physical activity came down, though some people took the opportunity to do more physical activity at home. But it also meant a lot of gyms closed, a lot of swimming pools closed. So a lot of energy that was being burned stopped. And that stopping of that, because one of the coping skills that we see that adults with ADHD use is excessive sport or excessive exercise. That's one of the, and when that stopped, it became more clearer that, oh, if I stop this, I can't function. So these are some of the reasons, I think, that made it extremely hard for adults to cope with the pandemic if they did have ADHD. And also social media, then they went more on social media, and then social media, for whatever reason, decided to promote ADHD more around the same period. And then people started taking these questionnaires, and I think they started thinking, yeah, that's what I have.
I mean, since you've brought this up, then I think it's a great kind of moment to ask this. So there is this kind of Instagramification of ADHD, neurodiversity. You see reels where, like, if you do these 3 things, then it means you have this. Or take this online quiz to find out if you are. And, you can fill in the blanks with anything, right? I'd like to talk a little bit about that because, on the one hand, I think social media has been great to really bring out some of these conversations and be open for people to be able to talk openly about how they feel and what they're experiencing. But there also has been some criticism that it's kind of reduced, what is a spectrum, what is a very wide-ranging, thing to have into this like 30 seconds of content. So I'd like to hear from both of you. And is it a good thing? Is it a bad thing? Can we even look at it as a binary when this is a spectrum? So I'd love to hear from both of you what you think about this, and if you have any kind of anecdotes or experiences to share around this.
Okay. I think in fact that was, when we were discussing earlier, it's a difference in brain's developmental abilities, right? So, I mean, even if we were to sample, every single person sitting in this room, and if we were to assess, attention, concentration, impulse regulation, motoric fidgetiness, if we were to, assess that in all of us, I'm sure we'll get the bell curve, right? So there will be, the majority of us who may fall somewhere along the middle, and there'll be a lot of people on either side as well. Now, the thing with development is that ultimately development is or our developmental abilities, if they do become problematic, they become problematic in context. Unlike mental illnesses, so a mental illness is something, if you have it, the dysfunction and the subjective distress are going to be there all the time. right? But like she was saying, if somebody has ADHD and they like a lot of activity and they like a lot of movement, and I keep telling adolescents with ADHD, when they worry about careers and futures and all, I said, don't worry about that, because you're going to find a career that suits you best, right? So it's about a match between developmental ability and what do I choose to do. And which is why, there can so although ADHD typically onsets in early childhood, sometimes the diagnosis can be delayed for this reason as well. So kids who are, otherwise intelligent, they don't need a lot of time to sit down and study. That they're very good with doing last minute reading and making sure they get good marks. And, like you said, you're getting good marks, no problem, all's well, right? So the trouble happens as they reach grade 7th, 8th, and 9th, where they really have to sit down, where it's not enough to just be smart, where you really have to sit and, complete that essay and, write a story and submit projects and assignments. So the dysfunction starts showing where your developmental ability doesn't match what you're expected to do, right? So developmental abilities in that sense are contextual, right? Similarly, some of us are great at maths, can go by till class 9, myself, come class 10 and don't really know what's happening, right? Because that's again on a spectrum. Our abilities to do gymnastics is on a spectrum. So these are all developmental abilities, right? These are all abilities that are spread across a spectrum. So I think that is the important thing to understand, that unless the context requires a certain amount of a developmental ability, the dysfunction may not show up.
Social media influence on the entire population is great right now, right? So what did ADHD coming on social media do to us? One, it did help people start thinking, oh, maybe this is me. Maybe it gave a little bit of validation, saying I'm not just lazy, I'm not just useless, but there's something not right about me, especially adults, we saw that. So a lot of kids that got missed because of whatever, their environment was okay, or but they were struggling as adults, could identify and then say, no, this is what is wrong, and this is how I mastered it as a child. So that knowledge and education and that validation and the formation of communities obviously helped the population a lot. The problem with it has been that it's been very oversimplified, right? So if you have this, this, and this, it is ADHD. It is not usually that simple. Nothing is that simple in life, right? You may have attention deficit, you may be restless, you may also have some impulsive behavior, but does not necessarily mean you have ADHD. So it needs a thorough investigation, it needs to be, other diagnosis needs to be ruled out. Yes, so though it brought it to the awareness of everyone, it oversimplified. And also it's like any other mental disorder, right? Like people saying very flippantly, I'm depressed, when actually someone who's actually depressed next to them will feel like they are somehow invalidated. Because depression is a serious condition, right? So just because someone scratched my car today or something, I can't use that word flippantly and say I'm depressed. And the same is happening with a little bit with ADHD. Oh, I'm sure I have ADHD. When all you have is maybe you're more active than others, or you have more energy than others, and so you start saying, I have ADHD, but I'm the CEO of a company. And so how does that then make a person with severe ADHD? Does it invalidate their feeling, saying that if you have ADHD, all these people are saying that you can do remarkable things, then does that mean that I am somehow not okay or not right? So like Isha was saying, it's a spectrum. We have to give it the recognition that it needs, that it's a serious disorder in some people. All of us may have traits of it, but it is not a disorder in all of us. And all this Instagram, TikTok, whatever has happened, has made it a little flippant, is my worry, and which may not cause problem to the rest of the population. It may lead to a little bit of overdiagnosis, a little bit of misdiagnosis, which is also a problem. But the bigger problem is a person with severe ADHD might feel a little invalidated with this flippant.
I think I missed this part. So that it's contextual. I think, of course, I'm not going to get into the fact that kids, engaging with social media, that there is an entire, different conversation around why that's problematic. But if I have to state just one point, I think, see, when as an adult, I view some content, I have a slightly better, so I know a little bit more about the world in simpler terms, so I know who's saying this, I know where it's coming from, I have seen, 40 other stories, I've heard people around me and so on. So I have a little more context to interpret, what this means and how am I going to take it, because I am much more developed in my self-identity, in my self-understanding, so I have a little more ability in that sense, to take it in a certain way. But as a child, where you're not, completely matured in your personality formation, you're not completely sure about what your strengths and abilities, so a lot of identity formation is really happening. So when young people, especially adolescents, when they go online and, they start identifying with stories around ADHD or stories around anything for that matter, around depression, around self-harm, around, eating disorders. So the trouble is that somewhere interferes with this person's identity formation. I've had a couple of kids, in fact, just recently in our outpatient, where am I anything other than ADHD? So is my self-identity anything other than ADHD? So the entire self, including self-esteem, self-other differentiation, setting your goals and ambitions. So everything gets impacted by, the so-called syndrome called ADHD. And then, you don't really know what else is this person's identity formation getting, influenced by. So I think for young people, there is this additional layer of vulnerability, beyond just the matrices of diagnosis or not.
And they're doing it in a joking way, and they're being very flippant about it. One of them like, oh, you don't have ADHD, or no, I think I'm autistic. And it's and within that circle of a small group of, young people, it is there. And then if you kind of come in as this parental figure and like, you shouldn't say that, then you're this kind of stick in the mud who doesn't, get why they're saying the things they're saying. But I do want to, touch upon this aspect then of assessments and diagnostic tools and just access to them, knowing where to go. So when I've spoken to people, especially adults, and sometimes even to parents, there is this thing that, there are really long waiting times for assessments sometimes, or some adults have found the entire process of being diagnosed very overwhelming in what is already a difficult time for them. Sometimes for parents, they don't know where to go and how to go about doing this. So then I've heard adults tell me things like, but it's I can just go online and take this quiz and then I know what I have. And if I'm saying this and it makes me feel better to know why I am the way I am, why is that a problem? So I'd like to talk a little bit about assessments, diagnostic tools, and, just if both of you in your kind of fields of experience could talk us through what an assessment would look like for a child and what it would look like for an adult and what they can expect. Why are there such long waiting times? Why does it take so long? I think that would be helpful.
So, see, any psychiatric diagnosis, whether it's ADHD or autism or anything else, the gold standard for a diagnosis is a thorough clinical evaluation. Right? So, for diagnosis making, we don't rely on any assessment score or, how much did you perform on self-rating or other rating or parent rating. So, those are not tools for making diagnosis. Having said that, there are some structured, semi-structured questionnaires that can sometimes be used, but even those, perform less better as compared to a thorough clinical diagnosis. And what does that mean? That means that you go to a psychiatrist, you have a couple of, and sometimes with children, we like to take at least 4 or 5 sessions before we actually say that, there's a disorder. Right? Because all of us have a little bit of inattention, all of us have a little bit of impulsivity, but is it a disorder? Is it something that's creating dysfunction? So to arrive at that conclusion, we may want to meet, with the family and the child many times. And in this process of clinical evaluation, it's not just about, looking at the complaints and the symptoms, but it's also about understanding this child's other developmental abilities. It's about understanding what the parents do, what is parenting like? Because sometimes a parent, it's not uncommon, for the parent to think that my child is inattentive when the child's attention span may actually be within, normal ranges, but just not as the parent would want it. So a parent may want the child to sit and study for 2 hours, which is actually not needed. If you have an attention span for 40 minutes, it's perfectly fine, right? So we have to look at family parenting practices. What's the school like for this kid? Is there an adequate adjustment as far as peer relationships, relationships with teachers? So you put all of that into perspective and then decide, the complaints that this family is coming to me, does it qualify for a diagnosis of ADHD, right? So a thorough clinical evaluation is the gold standard for making any diagnosis in psychiatry. Now, having said that, now suppose I see, an 8-year-old child where the parents have come with the complaint that my kid is hyperactive, and I want you to tell me if there's ADHD. And if I suspect that, this child also doesn't seem to be, having the thinking ability or, the social repertoire of an 8-year-old child, seems to be interacting like a much younger child, and I may suspect that maybe there's intellectual disability, and along with that, there is some hyperactivity. So then, for clarification and so on, I may want IQ testing, I may want, additional levels of observation, I may want a school report, so I may want, several different types of reports, and pooling all that together, I think sometimes take time. But a clinical evaluation is finally, going to be able to put together all this information and say whether there is ADHD or not.
I understand the distress that people have spoken to you about. And a lot of the time when people come hurriedly and say, I want a diagnosis and why not give? I'm like, what's the hurry? You've lived with this for like 25 odd years. So give me at least like 25 days, right? So let me see you a few times before. Because like Isha said, it's a thorough investigation of the entire life, the entire context of the person, rather than just one test. If we send a questionnaire to all of you now on a scale of 0 to 10, how much inattention do you have, how much impulsivity? So all of us will fall on the spectrum somewhere, like Isha told. It's a bell curve. So it's only a disorder when it's like at the extreme. And you can also have extreme inattention, impulsivity, and hyperactivity in a lot of other disorders. Like you might, someone may be using substances that may cause all of that. Someone may be in a hypomanic phase that may cause that. So so in AMAHA, what we do is we first have a thorough assessment. And in that one first assessment, I establish why do you need the diagnosis? What will it mean if I give you a diagnosis? And what will it mean if I don't give you a diagnosis? If I say, no, you don't have ADHD? Because I think the distress is coming from that. Because the distress is not that I want ADHD, but the distress is I want to explain why I'm doing this. And the answer may not be ADHD. So if you just push me to give a diagnosis of ADHD, I may be not serving you properly, right? So it's very essential to take time to do a first long assessment with a person. And then we insist on seeing family, anyone who have knowledge about their childhood, because according to current guidelines, the symptoms must be present before the age of 12. And if there was absolutely no symptoms, and we talked about how symptoms can be hidden and all of that, but as psychiatrists, we're trained to kind of uncover those hidden symptoms. And we can get the flavor of ADHD, even if there was no actual disability because of the symptom in childhood. And if there was no flavor of ADHD at all, like Isha told earlier, in childhood, and you've suddenly started seeing the symptoms of ADHD in adulthood, it's very unlikely that you have ADHD. So we do a first initial assessment, and then we insist that they bring in family, which means anyone who has any knowledge of their early childhood, which usually, typically, preferably is parents. Sometimes they're not in good terms with parents, so we said, okay, an older sibling will do, an older cousin will do. And if possible, we also interview one person in their current social, like someone who can give collateral history of their current well-being, of how the symptoms are manifesting in their life at present and how that's causing a disability in them. So that takes another 90 odd minutes. So and at the end of that, we may give the diagnosis, or like Isha said, I might think, oh, maybe this might be also related to, like slightly low IQ, or it might have autism more than ADHD, so I might say, let's wait, let's do more testing. I've had young people come to me convinced that they have ADHD and try to convince me and parents and everyone, and after 3-4 sittings, it suddenly comes out that they've been using cannabis for about 18 months. In the presence of a substance use, it becomes very hard. Even if you had, so this young person I'm thinking of does have a flavor of ADHD in childhood, so potentially did have ADHD to a degree in childhood, but what the current problems they're facing is definitely not due to ADHD. They have kind of reached a level when it's no more a disorder. But the symptoms that they're having or the struggles they're having is mainly because of the cannabis use rather than... So if they just stop the cannabis use, they're going to be much better off, and they'll manage whatever remnants of ADHD symptoms they have as an adult, even without medication or even without any intervention. So it's very important to take it slow, try and figure out and understand, and really for the young person or the adult to be truly honest during the assessment, because it should be an explorative, why is this symptom there, rather than I want ADHD as a diagnosis.
This brings me to my next question. I have a lot of parents who reach out to me and ask me about our own journey with our son in a way to kind of understand how they should navigate this. And sometimes parents come and say that, oh, but at school, because sometimes school is the place that brings this up, and, at school they've suggested we do this, or they've said, or the parent would like an assessment, and they're told you should wait, don't do it now. Is there an age which is the right age to get an assessment done if you assess too early? If you could speak a little bit about that.
See, again, in psychiatry, when do you want to investigate a behavior? When do you want to investigate, any symptom that a person may be experiencing? If there is either subjective distress, so if the individual is feeling unhappy, distressed, anxious, or, in some way not okay about having that symptom, or there is dysfunction that's visible to everyone, right? And I think which is why like you said, that sometimes at home, parents are okay, if the parents themselves are, active people, and, that they don't mind the kid jumping around the whole time, and, they're okay with it. But the school expects a certain repertoire of behavior. So, the school may be quicker to point out that, we have 300 other kids who seem to be able to sit, then why is this child not able to sit, right? So the school may bring it up. So if there is distress, in the child, and which may actually happen in an older kid, adolescent, or an adult, where they say, I'm not okay, I'm not able to finish anything, I get panicked before the exam because I haven't been able to put in consistent effort. Or the adult may say that, it seems like I've been struggling with it, but now that I'm multitasking all the time, I don't know how to figure it out. So older people may, be able to experience that subjective distress. For younger kids, there may be objective dysfunction. So wherever sitting is expected, wherever behavioral compliance is expected, the child's ability does not match, with the thing that is required. So having said that, there is really no hard and fast rule around, how old should a child be. Even till 10 years ago, our teachers had told us that, if a 3-year-old or a 4-year-old child comes to you, and the parents are like, the kid is hyperactive, maybe counsel the parents a bit around starting school, because sometimes, even those of us who are not our attentive best all the time, but when, we attend that one class where we have to take notes, or that one subject we're struggling with, we somehow, put together our abilities and make sure it happens, So structured environments help people with ADHD. Right? So structured environments always diminish distraction, they diminish impulsivity, and they, help behavioral regulation. So we were taught that, let this kid start schooling and then let's reassess. But in, the recent years, there have been several studies that have demonstrated that preschool kids, so 3 or 4 or 5-year-old kids, can actually, you can differentiate whether there is ADHD versus, the behavior is within, what we would call normal ranges. So it is possible to pick it up in preschool kids. But like you were saying, at the end of the day, you're not... developmental problems don't cure symptoms, right? So we're not giving medication, we're not doing intervention to remove symptoms. We're doing interventions to increase adaptation, right? We're doing interventions to promote a better fit, right? So depending upon the dysfunction that has come to us, the intervention would accordingly be tailored, right? So, but there is, as such, no younger, limit. Generally, I mean, kids have come to us, 4 years old, 5 years old, where sometimes we have had to, teach the parents, coach the parents about how to, do better behavioral regulation and so on.
So coming to this, to the interventions, and I think there is, there's occupational therapy, there is counseling, there is medication. How different what do the interventions look like in young people? What are the things parents can explore that they should know about, that are options for them? And then, does occupational therapy work in adults? And what are the tools available to adults to better kind of manage where they are post a diagnosis? So if you could.
Yeah. So yes. So like you said, there is there is behavioral management. There are medication, and in fact, if you go by some famous authors, who've written a lot of scientific literature on ADHD, you'll read that medication. So if you do have severe ADHD, stimulants, which is a pretty efficacious medication for ADHD, can really have big, can make a big difference to your experience with the diagnosis, to improving your functionality, and so on and so forth. So ADHD medication are, probably one of the most efficacious medication that we have. If you compare them with antidepressants for depression and, anxiety medication for anxiety and antipsychotics for, different conditions. So relatively, there seems to be a better, impact on symptom management, right? So yes, ADHD medication, and the reason why I'm not like I'm selling the meds here, but the reason why I'm saying that is because obviously, medicating your child is not a very easy decision to make, but it's important for parents to understand that if you compare if your child has severe ADHD and is just, not able to adjust in any situation, then by giving medication, you are really going to make a difference in this child's quality of life. You're really going to make a difference in peer interactions, in their ability to participate in games. So the developmental benefits do outweigh, any risks or any concerns that, we may have around the use of medication. But having said that, again, the medication are not curative. They're not going to remove ADHD from the brain, right? It's not that the brain will stop, having the problems it's having. Medication are an aid, right? And I tell parents very often that, if your child is right now 7, they are growing up, they are gaining other developmental abilities. They are also going to gain in their ability to focus, right? So compared to a 7-year-old, a 12-year-old will have a better concentration ability, will have a better ability to, regulate impulses and so on. So the brain will keep growing, but as the brain is doing that, how do we best support this child? Right? So how do we, so say, for example, if a child has a physical disability, can't walk. So while you get a lot of physical rehab and practice and so on, at the same time, for some time, you may need crutches, you may need, to support this child while walking. So similarly, how do you support the brain till the brain catches up, right? Till it can happen. So in that line, a lot of, so in terms of behavioral interventions, we're basically looking at, can I change the environment so that it's less distracting? Can I chunk the tasks? Can I make the sitting time requirements a little bit lesser? Can I use a lot of rewards and motivation to keep their attention going? There's this marginal value theorem which questions the evolutionary origins of ADHD, and it says that, is it inattention or is it poor motivation? Because we all know that we are much better focused at seeing movies than at attending classes. Right? Because the motivation is just sky high when you're watching your favorite movie, and that's what holds the attention, right? So using that in a behavioral intervention paradigm to, keep the child's attention sustained is something. So the behavioral interventions are all tailored to aiding, providing these environmental aids to sustain the child's attention. And then there's medication, like I said, which, do have a pretty good efficacy at managing the dysfunction.
So for adults, just to get it out of the way, medications do help, but in the extreme cases for adults, and we are a little more reluctant to give, especially the stimulants. Not reluctant really, but we're careful so that it is not misused and things like that. And then there's atomoxetine, which is the non-stimulant, which is also useful in some in a proportion of people. But the majority of people who come to me and who have been diagnosed as ADHD in their adulthood are just happy that they now have the knowledge of what is happening, right? They just wanted that validation and just education around the diagnosis, education around, because we've explored it in so much detail. The second part where I talk to the parents, we use a structured interview called the diagnostic, it's called DIVA. It's a diagnostic interview for adult ADHD. It's a very structured interview. So we've gone in depth with every symptom, and we've gone in depth with every disability that symptom is causing. So that's just an awareness raising process for the adult. So just the fact that they realize, oh, I'm not just being bad at work, I just don't manage time properly. Or I'm not being lazy, it's just that I can't start, or, I procrastinate a lot. Or it's not just that I'm brainless, I lose things because attention is not there. It's not that I'm not interested in my relationship, I'm actually interested, but I just can't keep attention if my partner goes on a very long conversation, and that's causing problems. So just awareness of the disability that the symptom is causing is sufficient for many people to change their environment in a way that is conducive to, because like we all have quirks, we all are different. I may have very good attention, but I may have anger problems, and then I adjust life, or I train myself, or my environment trains itself to manage that quirk that I have. So many adults just want the diagnosis, they want an understanding of what the diagnosis is, and then they're fine dealing with it themselves. And then they read resources and things. The more the higher on the spectrum they are, we get them into therapy. And you asked about occupational therapy. We do not have full-fledged occupational therapy. We should, really. But what we try and do is identify, like I said, the disability. So if time management is a problem, then the specific therapeutic part of it is, how do I teach you to time manage? And then the thing we discuss with adults is, there are two ways to do it. Either I train myself. So I have a disability and I train myself. So I do it repeatedly. Like Isha said, doing something habitually, repeatedly, will create networks in your brain such that you can continue to do it. Right? Even though it was underdeveloped, even though that is hard for you, if you do it repeatedly enough number of times, you may develop the ability to do it. So we help that. But there are extreme cases where they say, no matter how much I try, this is not possible. Then we say, use external, like, you build a fort around you. So can you use some technology to help you time manage? So are there alarms? So you can't remember. Can something else remember? Can technology remember it for you? Can AI do it for you? So we try and connect them to apps, and there's so many resources now for every single ADHD symptom, like time management, diary management, the Pomodoro technique. There are clocks that are created for Pomodoro technique. We either say, create that, and sometimes even that doesn't work. And then we say, there's one more external layer, which is another human being. Machine doesn't help. So you either have to get a very good partner who will time manage, or failing that, you get a EA, an executive assistant. So I see a lot of COOs, COFOs who have ADHD, right? And they know they're really bad at time management. But the only thing they need to invest in is a very obsessively time manage, someone who will time manage for them. And all that the person does is, okay, you have to leave this meeting, go there, and you have to call this person, and you have to do this. And because they're good at doing all of that. It's just that they don't remember to do it, right? It's just not in their, executive function is a little bit poorer. So it's either internal change by practice, or add some gadget, or add another layer over it. That's how we try to train. I'm hoping that we'll have more and more specific. And also, Isha said a very interesting thing. If the person is mismatched with their environment, then we have to suggest an environmental change. So a person with ADHD has become an accountant. They're good at maths, but they can't sit and look at, series and series of Excel sheets. So we suggest, what's the change in work you can do such that you can use your skill, but you don't have to look at Excel sheets, right? So, that kind of modification. Because it's almost like how Isha was saying, is it really a disorder? Sometimes we have wondered as psychiatrists. Or are we evolving to have lesser attention? When I was a child, there was this one bakery near the house which made carrot cake on every Wednesday. And if I wanted to eat carrot cake on Thursday, I had to wait till the next Wednesday. I had to save up that money, not use it for anything else, and wait till next Wednesday to go buy the carrot cake. Whereas my child wants the most exotic sushi, it arrives home in 20 minutes. So how do you train your brain to get attention nowadays? So is it that the environment is making us lose our ability to, focus, to attend? Because that is not a critical part of life anymore. As long as we are not hit by COVID, as long as the world does not go back into normalcy, it stays in chaos, attention has become non-necessary. So are we evolving into these beings, Homo sapiens 2.0, that doesn't need so much attention, that needs that impulsivity, that just needs to solve problems as they arrive very quickly? We don't know.
Great point for us to now open it up to the audience and for any questions that the audience might have for our panelists.
Hi. You mentioned that previously, especially in women, the symptoms may have turned inwards because we are asked to be quiet, speak less, not jump around, run around. So what if it turns inwards? What are some of the symptoms to look out for?
So usually, Isha can correct me if I'm wrong, usually children, young girls, usually look more dazed than talkative, because everything's happening inside their head. So there's so much chaos inside their head that they're not jumping around, going around, talking too much, interrupting people. But they're just dazed. They're in their own world, very dazed, right? In adults, we see it as very similar to anxiety, right? So it's like, I'm restless, I need to do something, but I'm not able to do something, right? And then it feels like laziness, it feels like restlessness. A lot of young adults who come to me say they're, I keep procrastinating. I know I have to do it, but then there's so much anxiety around it because they're thinking about the 100 things around it rather than the one thing. And so they just withdraw and they'll be like not doing anything at all. But just to clarify, and I think Isha and I have hopefully clarified this, all of us can have this at some point of time, right? And I'm very anxious when I speak about ADHD because I don't want to give the wrong message. It's about intensity of the symptom and persistence of the symptom. It has to be lifetime, and it has to be in every field of your life, like education, work, relationships, everything. And also the intensity has to be that high, because otherwise all of us can be diagnosed as ADHD.
Hi. As a clinician, a concern I have often is that people talk too much about the academic or the functional impact of ADHD, but what I see a lot more is the socialization impact of it, especially with young people, children, etc. So could you shed light on any things that could be happening in the academic space that could help us understand this better, support it better?
Thank you for raising that, because especially, technically sometimes you call them high-functioning kids, so kids who are otherwise intelligent are able to manage the marks, they don't really have to sit down and study in that sense. A lot of their difficulties actually arise in the peer contexts, so friendships are not easy, because you're just so restless and you want to do 10 things in a day, and all your friend wants to do is, just sit and, play this one board game for the next 2 hours, and, so friendships are hard, because for children, the ability to sit and engage is not just at academics, is at a lot of social, environmental, activities that they undertake. So peer relationships can be difficult for children with ADHD. There is also, children with ADHD can be quite vulnerable to bullying, right? And the reason is because these are the impulsive kids, or, the quote-unquote naughty kids. Everybody can pick it up that, all you have to do is tell this kid to go and, throw water on somebody and he'll do it. So before he's even thought through, what is this person asking me? What am I doing? The behavior has already happened, right? So these kids do, have a lot of vulnerabilities for bullying. The other is, So when we look at brain development, I mean, the brain doesn't know, will I have ADHD or will I have autism or will I have something else? But developmental abilities are all emerging all at the same time. So although the child may not be diagnosed with autism or with other social development problems, but a lot of kids can have social skill deficits per se. So they may tell you that it's not easy for me to really read the room. It's not easy for me to really understand is my teacher is angry or not. You'll not find a language and communication problem per se, which may have required an additional diagnosis and so on, but there can be social skill deficits. So it is important to understand that, and which is why the entire emphasis on what is the problem that the family is coming to you with. Inattention may not be the chief problem. You may diagnose ADHD, but inattention may not be the main problem. The main problem may be social skill deficits. The problem may be bullying, and then that's where you have to intervene. So yes, problems in the social sphere and the emotional sphere can coexist with ADHD and may require the necessary support and intervention.
I think it's me next here on the side. So my question is around diagnosis. Yeah, I'll just say. So with children, like you said, it's the family bringing in the child, but with adults, it's solo. Yeah, and there was talk of compulsorily talking to the parents, right? And what I thought of then was that sometimes parents will deny that my child has a problem at that adult stage, and this happened to me, so that's pretty much the question here. So what happens when the when the adult really wants the diagnosis, but like you said, it's not just the diagnosis, it's the distress and the trauma. So then how do we work with the parents then? That's the question. Thank you.
So when you do a very detailed DIVA assessment with the parent and the child who's an adult right now, what I've seen is, usually the adults will say, no, my parent's going to say no to everything. I was a perfect child. You'll never get anything from my parent. I will like, just bring them, right? This is just additional to what you have told me, right? This is extra history I'm getting. And then it's always surprising. Very rarely have I found someone who is very sure of themselves having ADHD, where I've not managed to find symptoms in childhood. So most of the time parents will be like, yeah, she was active but not overactive. I'm like, what are you comparing it to? So tell me examples of that overactivity. And there is a flavor, or they would have just lost too many things. Something was permissive in that environment, and which is what made the parents say, no, everything was normal. With a very detailed history, it is possible. Very occasionally, I've had parents who've said no to everything, just because they don't want the stigma. We've been talking about stigma around mental illness, and maybe that generation has a stigma around calling their child as having, a mental disorder, especially when we call it a disorder. Very occasionally I've had that, and then I seek other collateral historians. So can you get a sister? Can you get a... But if there is absolutely no flavor of... if you read Russell Barkley, who's kind of considered father of ADHD, he'll say if there's absolutely no flavor of ADHD in the childhood, as in the parent, you cannot get those 2 symptoms. Instead of, out of the 18 list, you can't get the 2 or 3 symptoms from the parent or a sister or a sibling, then it's quite unlikely that it was ADHD. Then search harder for something else.
So my question is actually the flip side of her one. What is your suggestion for a parent whose young adult child now has been diagnosed with ADHD? What is the, where is the line where you draw, where you say that, okay, this is the limit to which I can correct the person if he or she procrastinates or has time management issue? You don't tell them, then things get missed. You tell them, then they feel as if you're picking at everything that I do. So where do you draw the line as a parent of a young adult?
So you've just opened a can of worms. It's not about ADHD at all. This is about parenting a teenager and a young adult, right? It's really not about ADHD. Like, try telling a child who does not have ADHD, get up, do yoga, eat your meals on time, sleep on time. It is impossible. And if you do it too much, then you are their enemy. If you do it too little, you know your child's going to suffer in the long run. So it's a tightrope walk, no matter whether your child has ADHD or he or she doesn't have, or they don't have ADHD. So you just have to tell enough number of times and read their faces enough so that just before they become irritable, you withdraw. But you also don't withdraw so much that you'll be like, I'm going to give up on you. You do that, then, yeah, they're going to struggle. Especially a child with ADHD is going to struggle. So, yeah, lots of patience and lots of tightrope walking. I don't know if Isha has any better.
No, completely. And also, I think the entire process of, individuation that must happen in adolescence, so not everything has to be parented all the time. So I think there's also a need for parents to be aware of, where my involvement actually needs to start coming down, and where do I still need. And, like they say that adolescent parenting is different. It does require you to be more in parallel rather than, leading and pushing and pulling. So, that shift also needs to happen so that allow this young person to form their own self-regulatory rules and, whatever it is that this young person needs to, thrive.
I just want to say that when you said sometimes you suggest, getting an EA, I am my teenage son's self-appointed EA, and he's dying to fire me. He just wants me out of that job, but I'm holding on to it. Sorry, any other questions? Do we have time?
Yeah. What is the importance of diagnosing a child to ADHD or whatever it is?
It's at the end of the day ensuring a best fit, between everything that this child wants to do or, the family has decided to do, so it's all at the end of the day about increasing that, adaptation to the environment. So the importance is, how do I maximize the developmental potential? How do I maximize the gain that this child can have in this particular environment? So you're not, like I said, the intervention is not going to remove the ADHD or cure the ADHD. That's not the point. But the importance of picking it up early is so that I can make the dysfunction less, I can increase, the adaptation to the environment and thereby maximize the developmental benefits and, the learning that is going to happen in these different environments. So the importance is that.
One of the challenges with these sorts of sessions is that there's never enough time for questions. I do wish we could have as much time for questions as we had for the conversation. But what is possible to do is there's a speakers lounge and the speakers may be going there. If they are, you can continue your conversations there. But before that, I wanted to thank you, Dr. Sharma, Dr. Nallur, and thank you, Menika, for such an engaging, engrossing, and informative discussion.